Imagine this, a bustling city street, people going about their day. Suddenly, a man collapses, clutching his chest. Panic ensues as bystanders rush to help. Someone calls 911, praying for a miracle. In this heart-stopping moment, one thing is clear: every second counts.
Emergency medical services are critical. These professionals provide immediate care and transport. For many, EMS is the difference between life and death.
However, there's a problem. Access to emergency services is not equal. Many face barriers, from lack of insurance to fear of deportation. Healthcare should be a right, not a privilege. We must ensure everyone has access to emergency care. For the uninsured and underinsured, the cost of an ambulance ride and subsequent emergency room visit can be crippling. Many delay seeking help, hoping their condition will improve on its own. This delay can have devastating consequences.
Fear of deportation is another significant barrier for undocumented immigrants. They hesitate to call for help, even in life-threatening situations, for fear of being detained and deported. This fear puts their lives at risk and creates a climate of anxiety and distrust.
Language barriers also pose a challenge. Individuals with limited English proficiency may struggle to communicate their symptoms or understand medical instructions, potentially leading to misdiagnosis or inadequate care. Geographic location plays a role too. Rural communities often face longer wait times for ambulances due to distance and limited resources. These disparities in access are unacceptable and require immediate attention. The consequences of delayed or denied emergency care are dire. Stories abound of individuals who suffered needlessly because they couldn't afford treatment or were too afraid to seek help.
Take the case of Maria, a single mother who ignored severe abdominal pain for days, fearing the cost of a hospital visit. By the time she sought help, her appendix had ruptured, leading to a complicated surgery and a prolonged recovery.
Or consider the story of Ahmed, an undocumented immigrant who suffered a heart attack but refused to go to the hospital, terrified of being deported. He died at home, leaving his family devastated and heartbroken.
These stories are not isolated incidents. They highlight the human cost of our broken healthcare system and underscore the urgent need for change.
Section 4. The Moral Imperative, Healthcare as a Human Right. Access to healthcare, especially emergency care, is a fundamental human right.
Every individual, regardless of their immigration status, insurance, or financial situation, deserves access to life-saving treatment.
Denying someone emergency care based on their ability to pay is not only unjust, but also inhumane. It violates the basic principles of human dignity and compassion.
We have a moral obligation to ensure that everyone has an equal chance at survival and well-being.
Moreover, providing universal emergency healthcare is not just the right thing to do, it's also the smart thing to do. When people receive timely care, it prevents their conditions from worsening and requiring more expensive interventions later.
Investing in universal emergency healthcare is an investment in a healthier, more equitable, and compassionate society. It's about recognizing the inherent worth and dignity of every individual.
Section 5. A Healthier Tomorrow. The Benefits of Universal Access. Imagine a society where everyone can access emergency care without fear of financial ruin or deportation. This is the promise of universal healthcare.
When people are not afraid to seek help, it leads to earlier diagnosis and treatment, improving health outcomes and reducing overall healthcare costs.
Preventive care becomes more accessible, further reducing the need for costly emergency interventions. Moreover, universal access fosters a sense of security and well-being within communities.
People feel valued and cared for, knowing that they will receive help when they need it most. This sense of security translates into a more productive and engaged citizenry.
Furthermore, providing healthcare to all, regardless of immigration status, helps contain the spread of infectious diseases. When everyone has access to treatment, it prevents outbreaks from spiraling out of control and protects the health of the entire population. Section 6. A Call to Action. Building a more equitable system. Ensuring access to emergency medical services for all requires a multi-pronged approach.
We need policy changes that prioritize universal healthcare coverage and remove financial barriers to care.
This includes expanding insurance coverage and providing subsidies for low-income individuals.
We must also address the fears of undocumented immigrants by ensuring that seeking medical care will not result in deportation.
Investing in community health centers and mobile clinics expands access to underserved populations.
Finally, we must educate the public about the importance of universal health care and advocate for policies that promote equity.